We are very excited to be holding this Healthcare Professional Symposium. I will be your corporate host for the session. My name is Jared Warburton. I am the Director of Marketing for the Americas region, and it's great to see so many people in attendance today. We have a great show planned for you, and we hope that you'll find this very productive. We have just a great faculty of both corporate scientist speakers as well as healthcare professional speakers. And they're going to share with you today how to implement a preventative health and wellness model in your healthcare practices. And so I know that you're going to find your time very well spent here. So I'm honored today to be joined by Dr. Michael Jason. He will be our clinical host for the symposium. Dr. Jason, this idea for the symposium actually came from him, and he's worked tirelessly to put this together, collaborating with corporate personnel as well as our healthcare professional presenters to put this together. A lot of work has gone into this event, and not only will you see the fruits of that work today, but you will also see that in the future with upcoming events that we have planned. We got a lot of exciting things to come, and I'm sure you'll all be pleased to see that. So ladies and gentlemen, please welcome to the stage Dr. Michael Jason.
Thank you, Jared, and welcome to the Healthcare Symposium. As Jared stated, my name is Dr. Michael Jason, clinical host and symposium coordinator. I want to thank the healthcare professionals and the healthcare interested individuals today who have traveled far and wide to attend this exciting event. Our mission today is to share with you the outstanding science and benefits of our innovative Pharmanex, Nu Skin, and ageLOC science platform. We will also share how these nutritional and personal care products can be applied to a proactive model for health and wellness to help others. We will share new scientific information that will help us all improve the lives of those around us, our families and friends, as well as ourselves, to feel better, look better, and live better. We will start part one of the symposium with a science segment led by Joseph Chang, founding partner of the Pharmanex and Chief Scientific Officer and Executive Vice President of Nu Skin Enterprises. Dr. Chang has brought with him an outstanding faculty of in-house scientists, PhDs, who will share the innovative science and technology used to create these cutting-edge products. Part two of the symposium will cover the application and implementation of this extraordinary science in a proactive model. This segment will be brought to you by a select group of healthcare professionals who will share their experience, their great success, and leadership in sharing these products with others. Throughout the healthcare symposia, these healthcare professionals will share three things. One, what brought them to this great company. Two, how they have implemented these products and programs in their lives, practices, and professional networks of referring and consulting healthcare professionals. And three, why they enjoy sharing so much with others. Part three of the symposium will cover marketing, management, and international distribution from one of our company's top health industry professional leaders. But first, I'd like to expand upon the guiding principles of today's healthcare symposium: proactive prevention and reactive intervention. Which approach makes sense to you? Late end stages of a process where you apply reactive intervention in a more dramatic and desperate attempt to reverse the process, or much earlier intervention where you can apply a proactive approach to preventing a problem with proactive prevention. In my opinion, it is obvious which approach to take to achieve a better outcome. Let me share with you my professional perspective as a physician and cardiologist. As a cardiologist, I've been classically trained to deal with the later stages of heart disease, like seeing someone in the emergency room with an acute myocardial infarction, or meeting people for a coronary angiogram or acute coronary angioplasty and stent on the cardiac catheterization table in the hospital catheterization laboratory, or on the operating table for the open heart surgery procedure. This may be too late. On a personal note, I would like to briefly share with you a personal story of reactive intervention and why I've made a professional career of attempting to be more successful on the proactive preventive approach. When I went into practice, I returned to the town I grew up in, Great Neck, New York, to practice internal medicine and cardiology. One day, while at my office, my father called me up and said, "Michael, I don't feel well. Please come to the house right away." I ran out of the house and got to the house in about 5 minutes. And when I got there, he appeared pale, gray, ashen, and within 30 seconds of my arrival, he collapsed and literally died. He dropped dead right in front of me. I instinctively responded. I jumped up on him on the floor and applied the technique of basic CPR, assessing the ABCs of airway, breathing, circulation, and applied mouth-to-mouth resuscitation and started pumping on his chest, and then applied the first thump, and then ultimately a second thump. And with basic CPR and the second thump, which actually converted him from his life-ending ventricular tachycardia rhythm, and I was able to revive him back from sudden death. He went on to live for the birth of my second daughter, which to me and to the family was a miracle. For me to have been ready, able, and present to respond in such a life-saving manner. However, at this point, I realized that there was a better way than reactive intervention with CPR and that second thump. And my vision and passion began for proactive prevention, and this was born at that time. And with death came new life in my preventive career. Therefore, in my opinion, proactive prevention is greater than reactive intervention from both a professional as well as a personal perspective. Today we will look at depth at a more proactive preventive approach by studying the 6S Pharmanex process and the 6P preventive program as a formula for preventive clinical success. The 6S quality process being selection, sourcing, structure, standardization, safety, and substantiation will be covered at great length by our subsequent speakers. The take-home point for all of you in this formula for success is to use the 6S as a foundation, a scientific foundation, not myth, not hearsay, and not anecdote, but clinically studied, safe, and effective approach to apply the Pharmanex proactive prevention program for healthcare professionals like you and your colleagues and others to return to prosperity. The 6P Pharmanex clinical success formula. We also want to share with you today the healthcare professional proactive model of number 1, personal usage, number 2, practice implementation, and number 3, professional networking with your referring and consulting healthcare professionals et al. So how does this begin? It begins with breakthrough genetic approach, which after I was motivated to prevention, I need to be able to have the solution. And certainly the most proximal point in the pathophysiology of the natural history of disease, many things starts with genetics. So Pharmanex, through Dr. Chang and his colleagues that you learned today, developed the youth gene cluster approach to a functional group of genes associated with youthfulness, and you can see the DNA road to clinical success and road to prosperity right in front of you. This Nu Skin Pharmanex and ageLOC scientific platform is not an overnight event. It's built on 30 years of proprietary research, which has included the LifeGen Technologies approach to genomics. Through a stepwise, step-ladder approach, through breakthrough genetic approach to anti-aging built on this 30-year proprietary research platform, they've developed exclusive and patented science through this identification of youth gene clusters to identify differentiated anti-aging Nu Skin and personal care products. Through the NSE assets that Nu Skin Pharmanex has acquired, starting with from right to left, the biophotonic scanner, that Nu Skin then developed other technologies to enhance its ability to take this on. And ultimately, the LifeGen and Knox Technologies have been a great asset. So, with no further delay, it is my honor and privilege to introduce our first speaker, Dr. Chang. Dr. Chang is a founding partner of Pharmanex, Chief Scientific Officer of Nu Skin Enterprises. Dr. Chang has been instrumental in bringing to me a proactive preventive approach, which has been passion and just magnificent approach to helping people. He's brought to market numerous game-changing innovations, including the Pharmanex biophotonic scanner and the ageLOC scientific platform. Ladies and gentlemen, please welcome to the stage Dr. Joseph Chang.